Good evening, everyone, and welcome to 365 Live. I'm Bina, and I'll be your host for tonight's live session. Here's a gentle reminder that all information shared at this event by the speaker and 365 CPS is for general information only. Do consult your doctor for personalized and detailed medical advice. Without further ado, I'm pleased to introduce tonight's speaker, Physician Teo Pei Si, TCM physician from Kwong Wai Shiu Hospital. She'll be sharing with us more about causes of cancer from a TCM perspective and how we can adjust our lifestyle to address TCM imbalances, potentially managing delay and preventing the development of cancer. If you have any questions, please feel free to post them in the chat and Physician Teo will address them during the Q&A session. Hi, Physician Teo. Thank you very much for joining us tonight to share your knowledge with everyone. I've been attending a course on TCM recently, and I'm very excited about your presentation tonight. Let me hand over the time to you now. Physician Teo, please.
Okay. Thanks, Bina. So without further ado, let me just start my sharing today. So as you can see from today's topic, it will be very much based on traditional Chinese medicine. So these are some of the contents that we will be going through today, mainly talking about how TCM explains cancer and some of the common cancers being explained from the TCM perspective. And I think more importantly, what we all should learn about is point number 4 here, which are talking about what we can do, some TCM advice to diet, lifestyle, and even mindset changes. Okay, so the first part that I would like to talk about at this point will be to pose a question to all to just think about whether cancer is actually a scary thing to you. The reason why I'm asking this is because a lot of my patients, they get pretty jittery when they are told that they are diagnosed with cancer. And it's understandable because the background that we are all existing in does give us a lot of fears towards cancer. So we are being told pretty often that cancer is the leading cause of death within Singapore, and that 1 in 3 deaths in Singapore is actually due to cancer. So with that in mind, it's natural that we actually have some fears towards cancer. In fact, one of the studies recently actually found that the fears that people in general have towards cancer is that they think that cancer is vicious, unpredictable, and indestructible. So these are the perceptions that we have towards cancer. And in fact, the stories that we often hear from social media or people around us, they tend to surround concepts about struggles with cancer or even the strength that cancer survivors have. But how often do we actually hear about cancer survivors having treated by their oncologists and subsequently perhaps even going under remission and maybe even being discharged from their respective oncologists? So there are actually several of such cases out there whereby their condition is pretty much under control, and to the extent that they could actually be discharged from their oncologist. So another common reason why I find that many people feel cancer is scary is also because we are often told that there's this rising incidence, that more and more people are actually diagnosed with cancer. And this is just an article to share, and I would think that it probably creates even more fear. It's probably bringing out, the positive side of things as well. That we do have a younger generation of general public who are experiencing cancer, but at the same time, those who are below 40 tend to be suffering from cancer pretty often. The little bit of silver lining to this is that doctors do mention that a positive psychological mindset can be correlated with a better survival outcome. So with that in mind, I would say a lot of social media out there and a lot of knowledge that we hear from each other does give us the background that cancer is quite scary. But I just want to pose this question again, is cancer really that scary? So the reality is that right now, that the advances in Western treatment is already so advanced. We do have new cancer drugs, new techniques, more holistic treatment options, and even a lot more better tolerated treatment modalities out there. So the treatment-wise is not as scary as how we used to think they are. And definitely with a robust screening program out there by whether Cancer Prevention Society or other cancer associations out there, there are several new screening techniques which are able to help us find and detect cancer very much early in the stages. And in fact, it's estimated that about 40% of cancers can be prevented through screening. So with early detection and early treatment, cancer really isn't that scary nowadays already. So with that in mind, the next point that I do want to bring up is that there is also a greater awareness of health. People are reading up, people are attending talks, people have more knowledge about health, and people do start to adopt healthier lifestyles. The environment is also more conducive for us to practice more healthier lifestyles and such. So we are in general getting healthier. And finally, I would also like to mention that in terms of TCM oncology, there are there's really growing research and evidence-based practice on how TCM can come in for cancer treatment and cancer complementary care. And a lot of times it is actually Western Eastern integrative approaches. So with all this in mind, these are actually very positive points that we can see within the cancer landscape. And it's not just, within Singapore, even in China, Taiwan and such. The landscape for cancer is really getting more positive. So I would like all of you to actually think of cancer at least a little differently. So one message that I want to drive across today is that cancer is increasingly becoming a chronic disease too. So a lot of times when we are diagnosed with hypertension, for example, we will just be like, oh, okay, I'm old now, I have hypertension, I'll just take medication and I'll be fine, right? Hypertension right now is hardly, a very devastating diagnosis and such. But when we talk about cancer, when we talk about dementia, for example, or when we talk about AIDS, so these are diagnoses that are generally carrying a lot of stigma and a lot of preconceptions with them. So as a result, being diagnosed with all these diseases actually can add an additional layer of emotional stress that comes with it. And that in itself is not helpful for the condition at all. So this is one of the biggest messages that I want to drive across today, that with this advancing landscape for cancer, it is definitely something that is becoming more of a chronic disease and can be very well managed. Okay, so who is this talk for? Those who have fears for cancer. So my whole point today is to basically let the public know that cancer isn't that scary. Reason being that I've seen several patients who have come to our clinic and they are already under remission. So they are sometimes even discharged from their oncologist and they are very well managed. And they are basically living well with or without cancer. Yeah. And on top of that, because TCM is something that is very much focused on preventive health, for anyone who is keen to lead a healthy lifestyle, this talk will be very suitable for you as well. Okay, so I'll move on to the second part of today's talk, which is to basically explain how TCM sees cancer. So how does cancer happen from the TCM perspective? So this is a little bit of, I would say, drier knowledge over here. On the left, you can see that there's a diagram with 5 organs inside. And these are the TCM organs that we often talk about. And I would like to stress over here that these TCM organs are different from anatomical organs. And one of the most obvious ones would be for the spleen, for example. So the Western anatomical spleen is actually in charge of, several things related to the blood cells and even related to the immune system and such. But for the TCM perspective of the spleen is very much involved in digestion. So not just digestion in terms of like breaking down food, but also in terms of how we absorb the food and how nutrients are being distributed all around the body. So spleen has a very different concept in TCM versus the anatomical spleen. So that applies for all the rest of the organs as well, just that the difference may not be as obvious as compared to spleen. But one thing I would like to share over here is that in TCM, several things are just related to each other. Yeah, so there's actually a very famous saying in TCM that all 5 different organs can actually cause cough, like cough. So while we usually understand cough as being a lung disease or related to the lungs, from the TCM perspective, actually several other organs can possibly cause a cough as well. So using that as an example, if we do look at this diagram, you can see that the solid lines over here in the diagram, so those in solid arrow lines, they are actually showing relationships whereby they are supporting each other. So for example, if I were to focus on spleen, lung, and liver, right? The spleen is actually an organ that supports the lung. So that means that if I have a strong spleen, I'll have strong lungs as well. Okay. So the other thing that we want to look at is now the dotted lines in the diagram. So you can see that there are dotted arrows in the diagram as well. And from liver, there's a dotted arrow that goes towards spleen, right? So dotted lines over here actually describe a not so nice relationship now. They describe a more bullying kind of relationship. So when the liver is not happy or when the liver is not functioning well, it can possibly bully the spleen. And that's when you have digestive problems coming up as well. Okay, so one of the most common examples will be, for example, irritable bowel syndrome. It can come about with, prolonged stress or, exposure to a lot of high-paced lifestyles and such. So things like stress, anxiety, or even anger and such, they tend to harm the liver. And again, what I'm saying here is the TCM liver. Okay, so it doesn't mean that if you go and take a liver function test, you will have something showing up. So it means that it will harm the TCM liver. And subsequently, when the liver is not happy, it can actually bully the spleen. And that's where you can have like diarrhea, constipation, or alternating between these and such. So this is one of the most common examples that we will use when we look at the relationship between the organs. And when we look at cancer right now, ultimately, cancer is caused when there's a disharmony in the TCM organs. So disharmony meaning that the relationship between them is not well regulated, and there are basically organs bullying each other, or certain organs are weaker, and therefore their related organs are also weak as well. So with this disharmony in the TCM organs, there can be 3 common outcomes or pathological outcomes that result from which. So these are more abstract topics like phlegm dampness, qi and blood stasis, so overall circulation problems, and even toxins or heat and such. So these are more abstract topics which will take several hours perhaps to dive into them. So I'll just run through them very briefly. And the main point of this slide over here is to share how the organs are very well related to each other. And when the relationship is actually disrupted, then that is where diseases come about. Okay, so the next question now is, what causes this disharmony in the relationship between our TCM organs? So first of all, most commonly seen would be unregulated emotions. So this can often come from stress, anxiety, or anger, which I was mentioning can actually harm the liver, the TCM liver. Or even sometimes over-worrying things can also be harmful to the spleen. Okay, so later on, I'll also be talking about how different emotions are related to various organs. And when these emotions are not regulated, then a lot of times the organs get disrupted in their relationship with each other. And that's how cancer comes about. So of course, work-rest imbalance. So either too sedentary lifestyle or working too hard, multitasking, too fast-paced life and such. All these are also reasons why there can be disharmony between the TCM organs. So definitely, there's this saying that if you go to the Western doctor, they will say, oh, everything you can eat. But when you go to the TCM doctor, they will say everything you cannot eat, right? So that's kind of true, because later on I'll talk more about it as well. But from the TCM perspective, right, diet is an extremely important aspect of health. So whether it's not suitable for yourself or it's irregular diet, all these can actually cause diseases pretty easily. Then we also have external factors, and one of which most commonly talked about is actually smoking and how it causes lung cancer. So TCM will see such things as that they are external factors or sometimes even pollution that can also cause cancer and disharmony in the TCM organs. Then next point is about qi deficiency. So qi is basically energy that's flowing within our body. It helps to circulate the blood, and it ensures that our organs are functioning well. So there are some of us who just have a qi deficiency kind of body constitution. Sometimes we are born with it. Sometimes with all the other aspects that you have seen over here, it causes qi deficiency. So ultimately, when qi is being deficient, right, then the organs are not as well supported. They are not as well nourished. And that can also cause a disharmony between them. So finally, old age also, it kind of explains for several things. But as we age, definitely, we actually do have some organs that kind of deteriorate also from the TCM perspective. And when that happens, then that can also disrupt their relationship with other organs as well. Okay, so now we will move on to talk about the more common cancers in Singapore. So I'll be talking about colorectal, lung, and breast cancer. So these are areas that I would say we actually do see them so often that I can confidently say having early detection really makes a huge difference. So I'll be explaining them a little from the TCM perspective. So let's start off with colorectal cancer first. This is something that I screenshot from the Singapore Cancer Society's poster. So you can see here the risk factors are all listed out. And then on the right side, the signs and symptoms are all listed out as well. So you can see change in bowel habits, persistent abdominal pain or discomfort and such. So looking at all these, notice that these are all related to the digestive system, right? So I would like to just pose a question to the audience, or maybe Bina can come in as well. Yeah, so when we look at digestion, not too sure whether you can remember earlier on which TCM organ is actually the most affected when we talk about digestion. So we were talking about the liver, we were talking about the spleen, and we were also talking about the lungs just now. Yeah, so maybe Bina can help me out.
Are you testing whether I paid attention? Yeah. I think it was spleen. If I don't remember wrongly, it was 3 slides.
Yeah,
let's see what the audience say. Give them a few minutes to
see whether anyone.
Yeah, see whether they pay attention.
Maybe they will say spleen because you say spleen because they know you're studying.
Okay, maybe maybe it can be lung.
Don't listen to her.
The spleen affects the lung, so maybe the lung will affect the large intestine, right?
Okay. Okay,
spleen.
But yes.
Yeah, I see. Everyone says spleen.
Everyone says spleen, huh? Okay. That means, okay, my message did get across. Okay, so yes, so spleen is definitely the TCM organ that is the most affected when we talk about colorectal cancer. Okay, because we're talking about a digestion kind of problem. But the next question that may come to you would be, okay, so if spleen is related to digestion and colorectal cancer is, related to the large intestine, so where will the large intestine come in, right? So this is where I need to share a little bit more, because just now I shared 5 organs and how they are related to each other. So now I'll be moving on to share another 5 organs. Okay, so in TCM, we have 2 groups of organs in a sense. So on the left, you see our zang organs. Okay, so these are organs that are related to each other, like how I was describing earlier on. They either support each other, or they generate and strengthen each other, or they can bully each other. So this is the relationship between the zang organs that you see on the left side of the screen now. Okay, on the right side, you will see the fu organs. Okay, the fu organs. So these are organs that are a different group of organs from the TCM perspective. And you can see over here that they are actually paired up. So every zang organ is paired up with a fu organ, correct? So for colorectal cancer, right, while we do mention that it is very much related to the spleen since it affects the digestion, you can also see that the spleen is directly related to the stomach over here. And TCM also recognizes that the stomach, small intestine, and the large intestine, they are all connected to each other. Okay, so this is how we explain colorectal cancer from the TCM perspective, that the spleen is actually affected. And when the spleen is affected, the stomach, small intestine, and the large intestine is also affected. And if you look at it, the large intestine is all the way at the end of the channel. So a lot of times when technically things get stuck there, then that's where diseases arise. So to summarize this slide, on the left side, we have our zang organs. So their purpose here is to more of store essence. So essence meaning qi and other nutrients that are important to help the function, to help these organs function well. Okay, so on the right side, we have our fu organs, and their purpose is to so-called receive and transmit. So receive and transmit things like nutrients, and for the case of bladder, receive and transmit urine, right? So they are not meant to store things. They are meant to have things coming and leaving, okay? And when things get stored inside, that's where problems arise. So you can see that in the case of colorectal cancer, a lot of times when things get stored or stuck inside at the very end of our digestive system, which is at the large intestine, then that's where problems arise. Okay, so that's for colorectal cancer. We'll move on to the next very common cancer in Singapore, which is lung cancer. So again, this is actually a screenshot from Singapore Cancer Society. And notice that over here, they listed down the common signs and symptoms of lung cancer, which will often trigger us to have some screening done, right? But notice that seems like there are no risk factors being stated over here. So I just want to throw it out to the audience now again, and let me know what you think are the common risk factors that you know of for lung cancer. So I think the answer is pretty obvious there on the screen also. There's something shown there. So, Bina, do you want to try this as well? You want to hear from the audience?
Yeah, we can let the audience respond before I give my answer.
Because it's not so TCM.
Yeah, it's quite obvious, right? There's a photo of it. Yeah.
So the reason why I am asking this as a question is because sometimes the risk factors that we often hear of may not be the cause of the cancer. Yeah. So has anyone responded so far? Or
yeah, many people said smoking. Obviously because of the cigarette. One person mentioned pollution. One also commented that there are many cases of lung cancer with non-smokers, which I believe is the case in Singapore, right? There's a rising trend of non-smokers, chemical exposure, and I mean, I'm just guessing that maybe some kind of emotions might also affect people, and then they eventually get lung cancer.
Yeah. Okay, I think the point on no exposure to smoking and such, and still having lung cancer is the main point that I want to drive across here. So while we do know that smoking is a very common risk factor, so far, I would say easily 90% of my patients with lung cancer history, they have come to me and tell me that they have never smoked in their life and they have never had prolonged exposure to secondhand smoke as well. So an actual risk factor may not be the actual cause for lung cancer. And somehow for lung cancer is a lot more obvious. And unfortunately, that adds another layer to the imbalance in TCM organs. Because if I've been told and educated all my life that, you know, smoking increases the risk of lung cancer, and I'm diagnosed with lung cancer with no history of smoking, I would think that it definitely adds a lot of anxiety and a lot of worrying for whoever diagnosed with the lung cancer. So, and that doesn't help with the condition itself, right? But at the same time, I have also seen many of them who are under remission and they are all doing very well now. So from the TCM perspective, I think this will be where it is a lot more easier for us to explain lung cancer, because it's not just about pollution and exposure to cigarette smoke. There are actually other reasons that are possibly causing lung cancer. Okay, so in TCM, we actually have this saying that the spleen generates phlegm and then the lung stores phlegm. So this phlegm really is referring to the phlegm that we cough out, and we can see that phlegm. Okay, so we were talking about spleen being in charge of digestion, and it also takes care of absorption and how we distribute the nutrients, right? So if water is eventually not well distributed around the body, it can form phlegm as an outcome, and the lung stores the phlegm. Okay, so this is my next question now. So it's still based on organs, so not to worry. So Bina, you better be prepared. Okay, so what's the relationship between the spleen and the lungs in TCM? So is it like they support each other or they generate each other? So more positive kind of relationship, or does one of them bully the other in this relationship? So I'm showing the diagram here. Hopefully some of you have some photographic memory.
And I did some
so
homework.
Let's see whether
yeah, we will wait for our audience to guess.
Yeah, you don't answer first. I think you
I don't answer later. I spoil the yeah, but just now when I was mentioning emotions, right? There's this audience member who commented too much sorrow and sadness. Will it affect your lungs?
Yes.
It will.
Yes.
So lungs is associated with sadness.
It will. So we will talk about it later. The different emotions and how they affect the various organs from the TCM perspective.
Nice. Okay.
So,
wow. Everybody said generating, and based on what generating. Okay. The same audience member, Xiu Ling, she said Earth promotes matter, so Earth is spleen, matter is lung. So I think she's a shifu in this area. Yeah, but everyone say generating.
Okay, I think we have a very strong audience today.
Yeah,
talk about higher level TCM knowledge.
Correct.
Okay, so yes, so between spleen and lungs, spleen is actually more generating towards the lungs. So we can see over here. So that means that having a weak spleen would also cause weak lungs. Okay, so that's quite straightforward, I would think. So the idea of having too much sorrow and all these affecting the lungs, that is actually one area that is, I would say there's some research on it, but whether in real life, the research that's supporting it is not the most strong. It's not the strongest so far. But indeed, when we have a lot of worrying and a lot of sorrow, what happens is that the liver, okay, so the liver on the left-hand side there, so liver has its own qi as well, right? And the liver is such that the qi needs to move. So when you are very hyper, very stimulated, very overly stimulated, the qi will be like overly moving too quickly and too much. So when you are depressed, sad, very sorrow, then the qi will be just like very suppressed and it wouldn't be moving as well. So whether it's over or too little movement of the qi, ultimately it can still cause the liver to be not functioning in its optimal state, and therefore it can bully, which means to the right, to the spleen. Okay, it can bully the spleen and subsequently have impact on the lungs as well. Okay, so Another point that I just want to share over here, okay, so again, it's still our 5 organs on the left. Okay, this is something interesting that I found out while preparing for this talk. Okay, so we were talking about on the left-hand side. Okay, so we were talking about the zang organs, right? Their function is to store essence. Okay, so they store. So the fu organs on the right side, they receive and transmit. So things go in and out, right? So, and we were talking about, you know, how when that doesn't happen, then large intestine gets affected, and that's the cause of colorectal cancer and such. So interestingly, there's this pattern happening. So large intestine cancer, so colorectal cancer, can actually spread to the lungs. So they are related. So remember we were saying that the organs are paired up in TCM, right? So they do spread to the lungs. But very, very rarely do we see the other way around, which means lung cancer hardly spreads to the large intestine. Okay. Then if we move on to the next line, okay, gallbladder cancer can often spread to the liver as well. Okay. In fact, about 50% of gallbladder cancers actually spread to the liver. And the liver is one of the most common metastatic sites for gallbladder cancer. But then again, it doesn't happen the other way around. So liver cancer hardly spreads to the gallbladder. Okay. Then finally, the last line there, bladder cancer also can spread to the kidney because, I mean, yeah, all these organs, they're all quite closely located, right? But if we look at it the other way around, kidney cancer hardly spreads to the bladder, although they are still very closely related. Okay. So at the end of the day, this is just a pattern that I noticed that our full organs tend to have cancer spreading to their respective zang organs, but it doesn't happen the other way around. Okay, why this is the case, I hope I can do some study on it in time to come, but this is really something interesting because we can see that those organs that are meant to, you know, just receive and transmit, things pass in and out, they really need to pass in and out, and that's it. And then when it doesn't happen, then their corresponding organ, their corresponding zang organ can get affected as well. Okay. Okay, so I'll move on to the last cancer that I'll be talking about today, which is about breast cancer. Okay, so again, over here, you notice that there are common signs and symptoms being mentioned, but we do have risk factors, but it's not the risk factors that I want to talk about today. It's more of some patterns that I've seen from my patients with breast cancer. Okay, so I tend to see two extreme ends amongst my breast cancer patients. So one extreme end is, remember I was talking about the qi liver, right? The liver qi, right? So it's either the liver qi is very suppressed, right? And not moving very well, or the liver qi is a little hyper and overly stimulated. So amongst my breast cancer patients, I actually see two extreme ends in terms of maybe their personality or, you know, their emotional reactions to things. So on one extreme end, they will be the very quiet, very reserved, don't talk. You ask them one question, they answer one word, you know. On the other hand, you have those who are very hyper one, like little bit of thing, then they you know, and they shout, they talk pretty loud and such. So I do notice that most of my breast cancer patients belong to one extreme end of the spectrum. And ultimately, I wouldn't say it's a personality problem now, because there's no such thing as personality problem causing cancer, but personality does have, you know, a role to play when it comes to breast cancer somehow. And the emotions that are being involved as a result of your personality can actually put us in a situation whereby certain organs get harmed more easily. Okay.
Sorry.
Okay.
So while you're on this, like, just wanted to ask, like, so where does the breast fit in the TCM organ? Is it the liver?
Okay, that's a good question. Okay, so breast is not an organ in TCM, right? So, but from the TCM perspective, right, it's it breaks down breast pretty, how should I say, pretty in a pretty interesting way. So it looks at the breast as being related to the stomach. It looks at the nipple as being related to the liver. Okay, so a lot of times, if let's say we have premenstrual, irritation, very irritable, basically PMS premenstrual syndromes, or like, some of us may have sore breasts before our period comes. Okay, so all these are signs that, of course, from the Western perspective, we will see it as some hormonal changes. But from the TCM perspective, then we will see it as more related to the qi, the liver qi that is not being regulated. Yeah. So ultimately, when the liver qi is not well regulated, then it can also bully the spleen, like we were saying. And then the spleen and the stomach, they are actually the corresponding zang and fu organs. So I would say breast itself is definitely not an organ from TCM perspective, but breast cancer is very much related to stomach and also the liver.
Thank you. please go ahead to continue.
Okay, so we move on. Okay. So with all this in mind, I think this is actually the most important point that I want to drive across today as well. Right now is John. Okay, so I'll just move on with this one first. Okay, so this segment will be talking about the TCM advice to diet, lifestyle, as well as some mindset changes. Okay, so in this segment, I actually have 5 points that I would encourage general public to practice. So not just in terms of, doing all these to try and prevent cancer or manage cancer better and such, but all these are very good health tips that can keep us very healthy. Okay, and I'm saying all these from my own experience and also from what I see from my patients as well. Okay, so point number 1, I want to talk about developing self-awareness. Okay, so when we talk about self-awareness, there are actually various ways for us to develop self-awareness. And the reason why this is important is because only when we have self-awareness, then we can detect things early. So some of my patients who detected their breast cancer early or their nose cancer early and such, it's because so happen they feel, hey, how come got one lump? Then we faster see doctor and, it gets detected early. Okay. And the reality is that I have even seen, people, they can sneeze the whole day and don't realize that maybe they are having a flu, until someone asks them. So self-awareness is something that's very important for us to identify certain problems that we may have. And how to develop self-awareness, I have 3 points here. First of all, is mindfulness-based practice. So it can come in the form of meditation. It can come in the form of being aware of how your body feels and such, or even breathing techniques. Okay. Another one is muscle-based practice. So a lot of times we can also develop self-awareness by having awareness over our body muscles, and parts of our body that can be having tension. Okay, so there's actually this way of muscle relaxation technique that you guys can just Google, because I wouldn't want to delay this talk for too long. But this is another area that we can look into to help us develop self-awareness. Then finally, there's another form of practice that's called observation-based practice, which means it just talks about, observing things around us and observing how our body reacts to our environment. Okay, so this is one area that is also very helpful. And self-awareness is something that I'm still trying to develop. And I would say it's an ongoing process that is very helpful for all of us. Okay, so the second point that I want to bring across is know your personality. So I was talking about breast cancer, right? And that it often happens in 2 extreme ends of personalities. Okay, so at the same time, I'll be sharing 2 extreme ends of personality right now that both are not helpful to you. So first of all is the heck care people. So like I was saying, actually that person is my husband, by the way. He can have flu from morning until night and didn't realize that he was sneezing the whole day. And when I asked him, how long have you been sneezing for? And then he thinks for another 1 minute to tell me, oh, actually, I think I sneezed since morning. and it's like you didn't even know you actually caught a cold, right? But anyway, thankfully he has practiced self-awareness now, so things are better. So the heck care, I wouldn't say heck care lah. So it's not that they really don't want to care. Sometimes they just don't practice, observing themselves. So as a result, they don't know a lot of things that's happening to their body. Okay. So the other extreme end is the hypochondriac. Okay. So these are people who are extremely anxious about their health. In fact, sometimes they may have unduly worries about falling sick, or they come to my clinic and they will say, oh, my poop is got shape, but then it sinks. Is it good that it sinks, or is it good that it floats? And then when I say, oh, sink better, then they will say, oh, but I read that So I'll say, okay, sure. Or it will be like, oh, the doctor tell me this, but I think it's that. So they may tend to think like several layers beyond actual health knowledge, and that, like I said, it adds additional layers of worries, and that is not helpful to us, because again, that will cause disharmony between the TCM organs. So knowing your personality helps you being aware of it, and we have to move somewhere to the middle lah, right, where the little girl is. Okay, so I would say my personality is more towards the right hand side. Okay, but I recognize, so I'm not the extreme yet lah, huh? So I'm more towards the right hand side, but knowing that I'm more towards that side, I do bring myself back to the center as much as I am, as much as I can. Okay, so recognizing it and doing something about it can be very helpful, because it will help you regulate your emotions and subsequently help prevent a lot of diseases as well. Okay, so now then we talk about regulating our emotions, right? So in TCM, interestingly, every organ is related to one emotion. So for the heart is joy. Okay, so we can say that joy and happiness is good for your heart. Okay, but at the same time, too much joy, okay, I know it may sound a bit interesting. Okay, in modern life now, it's hard to have too much joy, but yes, it is actually possible to have too much joy, because that's where you get a bit too hyper, right? It can hurt the heart as well. Okay, then for liver, the corresponding emotion is anger. Okay, for spleen, the corresponding emotion is worrying. Okay, and I would say worrying and anger, these two are the most common emotions that in modern life we experience, and that is why a lot of times we have liver and spleen problems in modern life as well. Okay, then lungs related to sadness, like what was being mentioned by that participant just now. And finally, kidney related to fear. Okay, one of the most common example is also, if there's something that scares you out of the blue, then you will suddenly, lose a bit of control over your urine, and you may wet your pants a little. Okay, so I would say there's some basis to it, but the most obvious ones would be liver and spleen being affected by anger and worrying correspondingly. Okay, and next will be on a suitable diet. So from TCM perspective, a suitable diet actually means a few things. So first of all, healthy and regular diet. So this is the normal knowledge that we have: low fat, high fiber, more grains and such. The next thing is taking a diet that's suitable for your TCM organ imbalances. Okay, so I'm someone with spleen deficiency actually. And my liver qi tends to be, a bit too hyperactive. I get too excited too easily and such. So with that, there are certain diets that I shouldn't be taking. So for example, spicy things or too oily things, because all these are not well taken by our liver and our spleen. So there are certain diet that is suitable for specific organ imbalances. Okay, then other than based on organ imbalances, diet that is suitable for a TCM syndrome would be important. So whether you are too heaty in certain areas or certain parts of your body is too cooling and such. So diet that is suitable for your TCM syndrome will also be very important. Okay, and over here, I'm just sharing, very common knowledge that we actually encourage eating a variety of different colors of fruits and vegetables. So these are just some examples to share. And from the TCM perspective, actually every color is related to an organ as well. So on the leftmost side, sorry that this is Chinese, but I'll translate it now. Okay, so on the leftmost side, green is related to the liver. So green vegetables and fruits, very straightforward. These are good for the liver in that sense. The second one will be the heart. So red color is related to the heart. So things like carrots, tomatoes, red beans and such, they are very good for the heart. Then spleen in the middle will be yellow foods. So banana, pumpkin, yellow sweet potato and such. All these are very good for the spleen. Then the fourth one will be the lungs. So white color foods, they are very good for the lungs. Whether it's lotus root or Chinese yam and such, they are in a sense nourishing for the lungs. And the last one will be kidney, things like black beans, mushrooms, all these black food items. They are generally good for the kidney. Okay. So suitable lifestyle is my last point over here. What does it mean? So, oh, sorry. I don't know why my pictures are not showing. Okay, so what does it mean? So balance between activity and rest. The first point is very important. Okay, so if you're too overworked or you are forever, out there going around, hardly any rest, you're not sleeping enough, of course that causes diseases to come about. But if your lifestyle is too sedentary, that's also another cause of problem as well. Okay, the second point about activities which are suitable for your TCM body constitution. This is very important because based on your own TCM body constitution, there are certain activities that are more suitable for you. So for example, my TCM constitution is actually more qi deficient as well. So if I were to go for like badminton, sprinting, all these, I will feel so tired after these exercises to the extent that I can feel tired for a few days after that. But whereas other lower impact activities like yoga, Pilates, all these are actually more suitable for my body constitution. The last point on a profession that is suitable for you is actually more because your work takes up so much of your time each day. So if your profession is something that makes you sit all day long, then think about whether it's something that suits your body constitution. So some people just need to move. Okay, so like my constitution, I do need to move often, okay? Just that I need to move in a very low impact and, in a very safe way. Yeah, so I cannot be out there like jumping, all those more exciting things. They are not too suitable for my TCM body constitution. Okay, so this is my last slide over here. So another main message that I want to bring across, that health is often not valued until sickness comes. But a lot of things that we talked about earlier on, they can actually help to maintain health and keep us healthy, preventing not just cancer, but also several other diseases. So with that, this is actually the end of my sharing. I think it's time to pull Bina out again and see.
I'm still here.
Yeah,
thanks, Physician Teo, for your presentation. So it was quite interesting to see like how emotions can play such a big role in our health and like affecting different parts of our body. So I think one point that you mentioned towards the end was that like the activities and the diet that we eat to help us to like improve our qi or like achieve a nice balance in our bodies, also largely dependent on our constitution, right? So how do people know what their constitution is, or like what should they do to find out their constitution?
Okay, so I would say the easiest way is to really consult a TCM physician. But there are actually basic things that we can do to find out more. So things like looking at our tongue color and practicing self-awareness and knowing how our body reacts to things. Then these are small signs that can lead us to help us understand our body constitution a little better. I would say it took me a good maybe 2-3 years to fully understand my body actually. Yeah, so sometimes one consultation with your TCM also may not, help you fully understand your own body constitution. So definitely to consult a TCM physician is the best way to go. But if need be, we can actually talk about body constitutions in time to come, because every body constitution has like classic symptoms or classic presentations that we can observe from. And we can see from there, like, I'm roughly, what kind of body constitution. And from there, you can also know what kind of food and what kind of activities would be good for you.
Yeah. So, in general, do we need to like book an appointment before we go to a TCM clinic, or like we can just walk in like a normal Western clinic?
I think it depends on that clinic. Some clinics,
Oh,
they only
okay.
take appointments.
Oh,
Some
okay,
clinics,
okay.
both appointment and walk in. Maybe I should sell a bit of goyuk. So Kwong Wai Shu, we got both appointment and walk in. Let me sell a bit of goyuk.
Okay, nice. Are there like I don't know, online consultations like the Western telemedicine kind of thing?
Okay, I think that will be a bit difficult because the reality is that looking at the tongue is very important, and sometimes when we do it through online, the color, the lighting, everything can affect the accuracy of how we assess the tongue. And most importantly, we need to feel the pulse, right? Hello, you should know, right? So we need to feel the pulse. So okay, but the reality is that there are technology coming up whereby we can in future have wearables and detect the pulse remotely and such. But right now, we haven't had that yet. So going for a face-to-face consultation would still be the most accurate.
So I guess that will answer many people's questions over here, like how to know which organ is deficient, or how to improve. So please reach out to a certified TCM practitioner to find out your own constitution before doing anything, right? Because like I think you mentioned earlier on, some people, like there's a lot of information available everywhere. Like people can go onto Google and like search their symptoms. I have back pain, like why is this so? But at the same time, because like you shared that diagram that all the organs are affected, like the same symptom that we identify could be caused by many different organs, so you can't just tell from like one particular sign alone. Yes, so please do that when you can. And of course, you can visit Kwong Wai Shiu Hospital. They accept walk-ins and also appointments. So let me see. There's this interesting question. There are foods like birdnest or maybe like ginseng. Are these like good foods in general? And then when undergoing cancer treatment, are we allowed to eat? Because like will they also go and nourish the cancer cells? Then it makes it even harder to cure your disease.
Okay, this is a very common question. So, okay, whether or not you are having cancer, okay, nourishing foods like ginseng and birdnest, they are intended to add things to your body. Okay, so they are intended to boost your qi in the case of ginseng, and then for birdnest, they are intended to nourish your lungs, your yin deficiency and such. So they are more to nourish your body. Okay. So not everybody's body constitution is suitable for it. So for example, I have friends around me who, once they eat ginseng, their nose will bleed. Yeah, so and it's the same case if you are a cancer patient and your body constitution has been such, then you take ginseng, you may have a nosebleed, right? Okay, so but in reality, during cancer treatment, okay, so now we are specifically talking about cancer cases. It also depends on the type of cancer treatment that you are receiving. So a lot of times, those who are undergoing more radiotherapy kind of treatment, their body will tend to be more heaty. And the heatiness in the body can tend to continue with them and stay in them even years after the radiotherapy has ended. So it can be seen from the tongue, it can be felt from the pulse and such. So in such cases, then yes, maybe if you take some nourishing herbs that are more cooling in nature, then yes, you are trying to counter the heating effects from the treatment. Okay, so the heating effects are kind of like produced as a result of the treatment. So when it comes to TCM herbs and all these supplements kind of foods, right, they can actually help to reduce some of the so-called imbalances in the body that come about as a result of the treatment. Okay, so similarly for ginseng, I would find that ginseng in general is better for those who are undergoing chemotherapy. Okay, so those who are undergoing chemotherapy, they will tend to have a bit more qi deficiency kind of body type. Okay, but then again, it's still something general from most of my chemotherapy patients, but it doesn't mean that ginseng is the most suitable for everybody. Okay, and the last thing is also whether or not you're undergoing chemo, radio, or any other treatment, immunotherapy or whatnot. All this treatment, if you do want to take Chinese medicine while having the treatment, you have to consult both your oncologist and your TCM physician. Okay, because a lot of times the herb drug interaction is something that is of concern, and we wouldn't want too many layers to come in and complicate things at that point. Yeah.
Yes, so we have one audience member who mentioned that their mom is diagnosed with cancer and is currently undergoing chemotherapy. So I guess there are quite a few people I know of also who had cancer and they only go through chemotherapy, and then on the side they go and do like some other TCM treatments. So can you maybe briefly share what kind of treatments from TCM might help?
Okay, so during the chemotherapy cycles, right, usually what we will encourage is to have acupuncture complementing it. Okay, so at this point, because chemotherapy is still in place, or sometimes even in between cycles, right, I usually wouldn't encourage taking too much Chinese herbs. At this point, I will find that acupuncture is actually very good. It can actually help with some of the side effects that are being experienced from chemotherapy itself. Okay, so this is with regards to during the chemotherapy sessions. After the chemo cycles are already done, and the patients, they know that they no longer have to go back for further cycles, then usually what is good is that we can start to use some Chinese herbs and still complement with acupuncture, and all these will be very helpful in trying to gain back whatever imbalances in the body, whether it's qi being deficient from the process of chemo and such. So from the TCM perspective, right, actually we encourage a more lifelong approach to cancer because we see it as almost like a chronic condition. Yeah,
I guess sorry,
so even if
please continue.
under remission, right, we still encourage regular follow-up, and whether it's through Chinese herbs or through acupuncture, we still try and keep the body well regulated and well balanced.
So I guess it's more of like a mixture of both Western and Eastern medicine, whereby I guess when people are undergoing chemo, they can still receive acupuncture, and then after the chemo, they can receive like a wider variety to sort of maintain their condition or something like that, right?
Yeah.
Interesting. Okay, so somebody asked, Charmaine, how can we generally increase our qi? That's the first question, and then on my side, will it be too much? If you already have a lot of qi, then you don't know, but you go and increase your qi, will it lead to problems? So maybe you can answer Charmaine's question.
Okay, that's a very good question. Okay, so a lot of times, I think one misconception out there is that if I feel fatigued very easily, that means I'm deficient in qi because I'm always so tired, right? Yeah, but the reality is that yes, if you feel fatigued very easily, qi deficiency can be one of the pretty common reasons. But there are several other reasons behind this qi deficiency. Okay, so only those who have purely qi deficiency, then I will encourage them to take certain herbs to boost their qi, right? Ginseng and such. Okay. Other things, of course, there are other things that whether you are sleeping well, whether you have enough activity, whether you have enough rest, and all these, they will come in and affect your overall energy levels. But how we try and boost the qi and whether you really have qi deficiency is the main question here. Yeah, so a lot of times we may think that we have qi deficiency, but it may not necessarily be the case. Okay, but generally those with qi deficiency, okay, so my case, when I was in uni, because my body condition really wasn't good. Common symptoms of qi deficiency, like I said, yes, fatigue often. The skin tone will be a little bit on the yellowish side. Okay, so I was actually having a very tan skin back then, but yeah, if I ever have a chance to show my photos, you can see a yellowish tinge to it. Okay, so that's another common presentation. And the next thing is that the stools will usually be on the looser side. Okay, so you don't have well-formed banana-shaped stool, but it will be more loose, like, you know, specks, pieces that here and there kind of loose stools. And they usually have not much smell. Okay, so you have loose stools with very strong smell. That's a different story. It may not be qi deficiency. So loose stools with, you know, no smell, that kind, usually is a sign of qi deficiency as well. And there are also other presentations, like you often get bloatedness in the stomach, or you feel in general, you know, the digestion is not the strongest. These are some presentations of qi deficiency. So if you know that you pretty much fit what I just described, right, then yes, it would be good to take things like ginseng, in fact, some herbs like huang qi. Okay, I think it's called astragalus. Okay, I don't know English name, sorry. Okay, so it's also a good herb that is useful for nourishing the qi as well. Okay, but just bear in mind that whether we are qi deficient or not is something that is not so straightforward. Yeah. So do think twice before you start taking all these herbs, because like I said, if your qi is already over and then you go and nourish the qi, then that is where you can have things like nosebleed, you can get more heaty, so sore throat, constipation and such. Okay. Yeah.
Thank you. That's a very comprehensive answer. And I guess, I mean, it's quite interesting to know that, you know, even the shape of your stools, the smell, and then like your digestion, all these like small little signs, they sort of add up to your constitution. So I guess for the audience, it would be good to start having more self-awareness, like physician Theo advocated, right? To just see in general what kind of signs that you normally have, and then hopefully it will help your TCM physician better understand what your constitution is. And it's getting late. I don't want to hold physician Theo up, but I have one dying question before I close this session. So like, you know, we have a screening for using Western medicine. So is there a way for TCM to screen for cancer? Like through, I don't know, looking at the person's face, feeling the pulse, like based on ancient practices, how has cancer been diagnosed?
Okay, so the reality is, so ancient literature on TCM, right, they actually do talk about cancer, but by the time they feel the cancer is, they literally feel the tumor, which is too late by then. Okay, so when we talk about the TCM way of detecting it early, usually it's in a form of symptoms recurring. Okay, so things that perhaps were controlled by TCM, but you know, when you stop the TCM, then symptoms recur, then that is when I would say is a very important sign that I would usually encourage my patients to go for some form of screening and at least go through the Western doctor and ensure that there are no other issues before we continue with the treatment. Yeah. So when problems keep coming back, I think this is a very important sign that, you know, it may not be as straightforward as we think it is. Yeah.
So thank you, Physician Theo, for entertaining our questions, and thank you everyone for all your participation. I guess if you really want to know more about your body from the TCM perspective, then please do consult a professional, because there's a lot of factors that can affect you know, your constitution and how to, you know, increase your qi or prevent qi stagnation, that kind of thing. So yes, please seek professional advice. And now it's time for Physician Theo to take her leave. So once again, thank you for sharing your insights tonight.
Okay, thank you, everyone.
Good night.
Okay, good night.
Do like, share, and follow us on our social media pages for the latest updates on our events. Once again, thank you very much for joining us tonight. For those who join us late, there will be recorded sessions available on our YouTube channel. I hope to see you all in the next session. Take care, stay healthy, and good night.